I'm Dr. Midhun Malla. I'm an assistant professor currently working at West Virginia University in the main Morgantown campus. And I do see patients with gastrointestinal malignancies. It is my niche. And within the GI malignancies, I love taking care of patients with hepatobiliary and pancreatic malignancies or cancers, so which includes cholangiocarcinoma, liver, hepatocellular carcinoma, pancreatic carcinoma, and ampullary carcinomas. And I do have both clinical and research experience in that field. I'm fortunate to be part of the national cooperative groups, and I'm working with leaders in the field in collaboration in terms of clinical research and clinical trials in an effort to move the needle forward. In my opinion, there are at least three main reasons why it is important for the patients to get a second opinion. Number one, it is a rare and a highly lethal malignancy. It constitutes about 3% of all the gastrointestinal malignancies. However, the incidence is rising, and so has the mortality because of how late stage they tend to present. Number two, it is a heterogeneous cancer. Although the term cholangiocarcinoma seems like it is one cancer entity, it does have or include cancers that are coming from the liver, which are intrahepatic, and then outside the liver, called extrahepatic, which can also include the gallbladder cancers as well. Number three, it is a target-rich disease. So the molecular targets vary based on the anatomy of the origin. And most importantly, the treating physician should have experience both clinically and research aspect-wise in managing patients with cholangiocarcinoma so the patient can get the best care possible. So I do provide materials during the first visit. First and foremost is provide them resources that are available on Cholangiocarcinoma Foundation website. I advise them to reach out to the leadership of the foundation. I provide them the contact information so they can be registered on this website for free, and then also have access to the clinical trials available, throughout the country. Number two, I also help my patients navigate through the NCI website, which has detailed information about similarly the diagnosis, treatment options for different stages. So I would suggest, biomarker testing for essentially all my patients at any point I see them as a new patient. As I said, it is a target-rich disease, and we have to understand that fact clearly there. Irrespective of their stage, it's highly important. I tell my patients that cancer management is no more a one-stop shop. You come in, you get chemotherapy, you expect to do better, and then wait for the results. It's no more that scenario in this day and age. On an average, about 40 to 50% of the patients with cholangiocarcinoma have at least one actionable mutation. That's about 1 in 2 to 1 in 3 patients. That's a significant number. So by checking these biomarkers, we can open up doors for multiple personalized treatment options. And knowing that my patient has treatment options provides me and my patient more hope and life. So that's more important. So the terms genetic, genomic, biomarker, molecular profiling can sometimes be confusing and overwhelming for our patients. So it's important to differentiate between the hereditary and the somatic mutations first. Hereditary is something that can be both inherited through parents or ancestors, while somatic mutations are something that are acquired during an individual patient's lifetime. So these somatic mutations can also be termed in this process of our discussion like biomarkers or molecular profiling, so on and so forth. And biomarker testing can be performed either through tumor tissue biopsy or a liquid biopsy, which can be blood or other body fluid. These biomarkers can be diagnostic, prognostic, and predictive markers determining the response to the treatments. So if you do not check for those biomarkers, I tell my patients that we don't know whether a patient has them or not. And I discuss with my patients about the significance and the increasing options available in our arsenal so we can target and have. Patients should not feel that they're alone in the process, which tends to happen often. I discuss with my patients about the presence of support groups, both in person or social media. So these support groups online can provide both the emotional help to the patients, and most importantly, patients can relate to other people who are going through similar treatment for their cholangiocarcinoma. Cholangiocarcinoma Foundation is a great resource to access that information. Interpersonal connections are so valuable so that they are able to support one another. And so in that process, as I also alluded to before, I provide contact information of the leadership group in the Cholangiocarcinoma Foundation so they can get in touch with them, call them or email them and get access right away, so they know what they're dealing with and they know what options are available and what support groups are available.